Hey guys, Dave Cook here. Today I wanted to talk to you about Medicare.gov. It's called myMedicare.gov. A lot of you have probably received an email from Medicare indicating that they've got a new system. Last year, what they did is they actually created a new system to where we used to look up your drugs and be able to keep track of those from year to year with which was called a drug plan ID number. And it wasn't associated to you for any reason. It was just a way for us to be able to compare plans from, say, the prior years to the next year. Unfortunately, the government changed over the system to where they lock us out from being able to do a lot of those things. So what we're doing is we're kind of asking for your help in regards to this, because the only way to get in there to look at your drugs without entering, for us to enter them in all the time, the easiest way is for you to kind of take some responsibility and understand this system. That's why we're putting this video together today, and it's because of that. I want to be able to teach you how to go through myMedicare.gov. I'm going to tell you there's going to be so many powerful benefits of this for you to be aware of what's going on with your prescription drugs during the year, what your plan summary of benefits are, whether or not you want to compare plans this year just to see if they, measure up to the same quality of plans that you have. The whole thing is what the government did is they put the responsibility on the Medicare beneficiary. So with this process, I want to show you how to walk through it step by step and create an account. If you haven't created an account yet, we may have done this last year together. We have a username, password, all that stuff. You can go into your account and you can look at your current medications, make sure those are up to date. We can compare what your current plan is from last year. There's a whole array of different things you can do with this. Printing your Medicare card. I'll get into the details more as we go through this, but I'm going to shoot a little video here on the computer just so you can follow along with me and walk through the steps. It's pretty simple, and the thing is you're going to get a lot of benefit out of this. So please just pay attention as we go through, and I'll jump into it right here. The first thing is myMedicare.gov. You probably received this email that says open enrollment. What they're doing is they want you to go in and create this account. As you can see, log in with the Medicare account. You can add prescriptions. You can update all this stuff. And here, it's time to create that account. Very simple. All you're going to do is go up here and go to Medicare.gov. You can go to Medicare.gov, and then you come down here where it says log in and create an account. Once you click on this button, it's going to populate, open another window, and I kind of have some of these just to make it simplistic that we can get through this video quicker. Here, you would say create an account now. This is myMedicare.gov. As you can see, myMedicare.gov. Each one of you have a beneficiary identifier number, and with that number, it's not your Social Security anymore. What it is, it's a weird array of different numbers, and it'd be like EW73-36Q, but it's at least now it's not associated to your Social Security number, which is finally the government realized that that's not a good thing to have on your Medicare card. So they switched that over a year ago or 2 years ago. But with this, you're going to say create an account, okay? And as you create an account, what's going to happen next is it's going to come up and it's going to ask for that weird number that you have on your Medicare card. Example. If I click this open, you can see 1EG4TE5MK72. And then it's going to ask, in one area here when you're creating an account, it's going to ask for your Medicare Part A effective date. So just remember that you need to do that. Then here that's your Medicare. Here you would enter in your last name. Email address, if you have one. You don't have to. I would recommend that you may not want this just because you're going to get inundated and possibly get more confused as Medicare sends out different things. But you have a choice to either put it in there or don't. Your date of birth, very simple. Your zip code, where you currently reside. Where do you currently reside? You reside in, say, Manatee County. I'm shooting this video in Manatee County. You could live in Sarasota County. So wherever you are, if you're 6 months in another state, in order to get a Medicare Advantage plan, which I'm talking a prescription drug plan is a Medicare Advantage plan, or an MAPD, also referred to as Medicare Part C. Medicare Part C typically has the help with the prescription drug plan, and you can enroll in that instead of original Medicare with a supplement and then pick up a prescription drug plan. I was going to tell you, my favorite, if it was me, I would probably go original Medicare with a Medicare supplement and a prescription drug plan. That's just my choice. Everyone has different needs. Medicare Advantage plans could work very well for you, and that's fine. You do have different networks of doctors that you have to stay in. You have a difference between an HMO and a PPO. You have different benefits, whether it could be over-the-counter medications that some plans provide more than others, whether it's a gym membership, vision, dental, there's a lot of benefits. So when you see Joe Namath on TV or whoever it is, call myMedicare.com or myMedicare benefits. When you're seeing these commercials on TV, what that is Medicare Advantage plans. You all have the access to get these if you're on original Medicare, and you can try them out for up to a year if you're on a Medicare supplement and then go back to that Medicare supplement. The only problem with that is once you leave a Medicare supplement and you go back to, say, a Medicare supplement, you're going back in at what's called entry age. Entry age means if I was 65 when I first took out that plan, then I tried a Medicare Advantage plan at the age 70, well, I'm going to go back in at that Medicare supplement at the age of 70. So just remember that. But let's go back to this page here. You're entering your date, your birth date. You're entering in your zip code. And then you also have your Part A coverage start date. Now, typically this is going to be, it's always going to be 0101. And then whatever year that you became eligible for Medicare. Then here, you're going to click this box. By clicking this box, you're going to click Next. Very simple. What's going to happen next is it's going to take you to a site to log you in, which would be this page again. You would enter in that username and password, and then that's going to let you in the system. One thing I forgot to mention, usually what I do when I'm creating the next page after this is going to be where you create your username and password. When I do things for my clients and we work through this, I usually put the name that's on their Medicare card. So if it's John L. Smith, it's John L. Smith that I use for a username. And maybe it's John L. Smith 1948 was the year that you were born. Whatever it is, make it something simple that you remember. And the password, use Dave Cook, ! 1, the number 1. I know it's got to be at least typically 8 characters, I believe, with a 1 special character and the number 1. That way, if you do Dave Cook, ! number 1 for your password, you always remember who your agent is, whether it's Don Cook or one of our other agents. It's just something simple to remember. Most people aren't going to associate you with me, but it's just a way to remember. If you have a favorite password, feel free to use that. But with that, I'm just going to it's going to log me out here for some reason. Let me close this. Let me take a look at these real quick. Okay. With this, since Dawn and I are not beneficiaries of Medicare, I actually have access to my mom's account. We look at my mother's account. We always take care of mom, right? I mean, it's just what you do. We take care of mom in regards to her Medicare. She has original Medicare with Medicare supplement and a prescription drug plan. She can go to any hospital, any doctor, anywhere in the United States that accepts original Medicare. No questions asked. No one's saying that she needs a referral. No one's saying that she needs prior authorization. The only problem is it comes at a cost. And the cost is different for different people, depending on what Medicare supplement you're on. If you want to go to a Medicare Advantage plan, it's totally your right. The difference is you may be paying a $0 premium, but then there comes a cost on the other end. Maybe instead of the premium being $200 for a Medicare supplement, now your cost is your max out of pocket, which could be $4,900, $6,700 if you're going out of network. There comes at a cost of everything in life. Nothing is free, even though we hear things all the time that it's going to be free this and free that. There's no such thing. But with this here on this site, you're able to do a good diagnosis. I guess I should use the word analyze. You can analyze your prescription drugs to your carriers to there's just so many opportunities. So let's go back to the Medicare.gov site. myMedicare.gov, here we're looking at, we got a little pop-up and it's going to say continue. So now we got another 5 minutes we can go through this. As you can see, under her account, she has WellCare prescription drug plan right now. Here in this area, as you can see, says view my plans and coverage. If I click on this link, it's going to bring up my current plan. So if you're on a Medicare Advantage plan, let's just say it starts with an A or an H, you could actually see the summary of benefits in your plan by clicking that link. Also within this site, this, like I said, this is a very powerful tool. You can actually find your 2021 plans. So let's just say that she's on a prescription drug plan. She wants to compare her cost, and maybe it's the premium that she's paying for that plan, the deductibles, what's the co-pays for this, when she's going to hit the donut hole, what pharmacies. There's a lot of different information that is, like I just mentioned, it's very powerful, and I want you to take an opportunity to look at this. The other thing, it just said, thank you, you're logged out. So great. So now that we're back and we're looking at her prescription drug plan, we could say find plans for 2021. The other things that we can do within this site is look at view our claims. If you're on original Medicare with a Medicare supplement, you can actually, because it's billed through Medicare, the government site sees all your claims. So if you had a doctor visit, you had multiple things. Stupid thing, government site. I'm going to continue. So if you have Medicare supplement with original Medicare and prescription drugs, like I just mentioned, you can actually look at your claims. Whether you were in the hospital, you can see what original Medicare billed or the doctor billed, what original Medicare paid. If you have a deductible, did you meet your deductible? There's things like that there. You can also come down here and say print my Medicare card. So that, remember that card, the red, white, and blue card we just showed earlier? By having this account, you can print that up anytime you want. Which is nice by you having control of this is us as agents, a lot of times we deal with beneficiaries that are on Medicare and they can't find the red, white, and blue card. We need that number in order to do applications for you. We need the Part A and Part B effective date. Now we can make some phone calls, but you having access to this, it's readily available at your fingertips because you are the Medicare beneficiary. The other thing that's very cool about this site is that a lot of our clients are taking different medications, and keeping this up to date, you have so many resources at your fingertips. Whether you go to CVS or you go to Walgreens or you want to go to Walmart or Sam's Club, I can tell you exactly what you're going to pay for with that prescription. That is very powerful because at the end of the year, that can make a lot of difference in your cost. It's just depending on what kind of drug you're on, that can make a huge amount of difference, okay? So with that, let's just kind of go into that. Where was I here? Here, I wanted to show you very quickly. If you go in and say view my plans and everything, here's the other thing. You can view the plan, which summary of benefits, or you can say print temporary prescription drug card. I think this is still up here. So if you click on this here, print temporary drug card, you can actually take whatever you need. You don't have to call the carrier, whether it starts with an A or an H or a W, whatever it is. You can just go in there. This is what the pharmacist needs in order to fill your prescriptions. If you've got all this information with the RX group number, the bin number, all that, that's all they need. This is all readily available to you in myMedicare.gov. But as we were talking earlier, this is kind of the key. Update, print my drug list. If I have access to this, to where you have accurate information, you send Dawn or myself or any agent that you're working with. This is the information we need, and it's all up to date. It's all spelled out. It's black and white. It's the T's are crossed, the I's are dotted. There's no need for confusion. Then once we know what pharmacy you want to go to, say you want to go to CVS, we can plug that in. Maybe you don't like a certain pharmacy, so we make sure we keep that up. I typically run it one way, and it's typically I'm going to put in a preferred pharmacy like CVS and Walgreens, because I know these are drug places right across the street from each other in most cases, and if you could save $10 walking across the street, you probably would. Heck, I'll bend over to still pick up a penny. It just happens. But if we can save money, this is key here. So with this, I'm just going to say use or update and print my drug list. Okay? So as you can see right here, update my drugs in pharmacy. Now, with this, there's certain things I can show you and there's certain things I cannot. Also remember that my mom is not here. She is up in Michigan. So these plans, what I'm doing right now is I'm going to show you plans that are in Michigan. It really doesn't matter whether I'm showing you, I'm just showing you a system. I'm not showing the plans down here, plus I could get into a little bit of difficulty by showing plan summary of benefits down here in Florida. So my plan is to show you this. For the most case, it's not going to apply to any of you, and I'm okay. But as you can see, these are the different drugs that we have in her formulary or for her prescriptions. Now, there's 1, 2, 3, 4, 5 medications. If I wanted to, I could click edit, and instead of every 3 months, I could change this to every month, or I can change the quantity. But let's just go through and add a drug. This is what you would do. When you first create your account, a lot of those drugs are already going to be there. You can see what my recent fills were. They would be up to a 12-month supply or a 12-month look back. The government knows when you're picking up prescriptions because it's all tracked to your Medicare number. Basically, people, you're being tracked. You're being tracked no matter what you want to do. It's just part of it. But let's just say everyone's asking right now about Novolog, or maybe it's just an insulin that, you hear the price of insulin has come down. It has on certain plans, but not all plans. But here, I just typed in Novolog just because I know it's an insulin, but I'm going to use the brand name, okay? So what comes up? 100 units, 3-millimeter pen, fine. I'm going to leave that. I'm going to go through and I'm going to say update my drug. So now my mother, who does not take Novolog, has that in her drug list. Let's just add another one just for kicks and giggles. Let's just add Eliquis, okay? Eliquis, you can see once I type in 3 letters, if I got the front 3 letters right, usually I can get the drug. So with Eliquis, I'm going to type this in, and then I say add drug. And let's just say it's 5-milligram tablet, and she's getting 2 a day every month. Well, I know that she gets every 3 months because she uses a mail order or a supply. So what I would have to do is change that from 160 to 180. Now I'm going to add that drug. Oh, I forgot to do that on the Novolog, didn't I? So it's very simple. I come down here. I say Novolog. I'm going to click on this. And I'm going to say 3 because she gets that every 3 months. Now I can see the full breakdown. I can always go through and change this whether I want a 30-day supply or a 3-month supply. I can change it. Sometimes I only get a prescription and it's every 2 months. Those are key factors that we're looking for. I got off the phone with a client not too long ago, and I found out she was only taking this every 2 months and this one every 3 months, but she was taking other things every month. Without us knowing that, we can't do a full analysis to give you real numbers. So we need that stuff updated. And that, who's better to do that than you? So as you can see, we've got those. We got a 3-month supply. I'll tell you, you're not going to like the price of this. And in regards to this little drug, let's call it Eliquis. You can see all these people happy on commercials, everything else. You're not too happy when you're filling these prescriptions for the cost. But we can maybe find some alternatives. There's always opportunities that you can look at to try to save money. But we got to start with the baseline. And as you can see, zip code 48060, back in Michigan. I grew up. Let's see, where did I grow up? This is Canada right here. And I grew up right here on Lake Huron. I used to fish down here by the lake, or the river. St. Clair River, went down to Detroit. But with that, I'm going to pick mail order pharmacy, and I'm also going to pick CVS and Kroger. Why Kroger? Typically, there's a preferred pharmacy. Down here in Florida, Publix. If we're running your drugs, typically we're going to pick a mail order pharmacy, CVS, Publix, and Walgreens, just to give you the best option for saving money. But now that I know that's done, I click done. What do I want to compare? At this point, I can compare Medicare Advantage plans, which are Part C, Medicare Advantage plans, MAPD plans, that's what MAPD stands for. Or I can just look, if she's got a Medicare supplement, I can look at the prescription drug plan only. Look, if you're looking at these Medigap plans, just give me a call. This can kind of get confusing. We can walk through this. We can show you the opportunities to save you money or at least keep your costs down, if that's something. But with her, I could do prescription drug plan, but it's only going to give me the basics. So I'm just going to see what's up there in Michigan in regards to a Medicare Advantage plan, so that this applies to a lot of Medicare Advantage beneficiaries as well as Medicare Advantage. So with that, the first plan that comes up in her area, please do not pay any attention to these numbers. They do not apply to you. Like I said, it's in another state, and the drug costs do not apply to you because you're going to have your own unique cost. But the first plan that comes on, once you create an account, is going to be the plan that you're on. So let's just do a comparison. I click on that, and the first plan is populated down here in the bottom, and it adds that for me to be able to compare at a later point in time. Look, I don't know anything about these plans up there, Medicare Advantage plans up in her area. I know that this one in network shows $5,000. Don't really care. It doesn't really apply to you. There's some other plan. Wow, they got a lot of weird plans up there. Blue Care. So that's Blue Cross Blue Shield. In every state with Blue, they have different. Look, I'm not trying to say anything, but just be careful about what plans and what carriers you pick. But with this, now that I'm able to compare these plans, I can look at the plan details here. I can look at the plan details of my prescription drug plans to see what my costs are for my prescriptions. I can also compare that to what it would cost if I was on a different plan. But here's the thing that's usually, I'm not looking at the summary of benefits. You can look at the different summary of benefits and see the different plans. And by law, I'm not supposed to show you the different plan options. Even though it's in Michigan, I'm not supposed to do that without what's referred to as a scope of appointment. So if you should be getting an email. We're looking for scope of appointments. Very simple. You just fill out your name at the top. your phone number, and whether it's your email address, just some basic, simple information. Sign it right down at the bottom twice. Type your name in, and I'll give you links. Matter of fact, while we're talking about that, why don't I just do that? I'm going to go to this place, and it's called Medicare. Whoops. Let me go back. Excuse me. So we've got the different drugs. Then I'm just opening up a new tab. I'm sorry, I forget to do that. Open up a new tab. For you people that are on the internet and you're worried about your stuff being tracked, if you download DuckDuckGo, they don't track all your stuff. You could also go in and actually put a VPN. I highly recommend a VPN just because I don't like being tracked for everything that we got going on. But if you go to Medicareful.com, just like this up here at the top, Medicareful.com/Dave Cook. Now, if you're dealing with Dawn, you would just go into Medicareful and you type in Dawn Cook. Very simple, right? So it's just Medicareful, Medicare, and then full.com/Dawn Cook. Then all you got to do is click Contact at the top here. Once you click Contact at the top, we're looking for the beneficiary name, first name, last name. Like, you don't have to put your email. It does help us keep our folders and our records up to date for things if you need us, or for us to convey information to you. Phone number, it's always good to have that. You don't have to fill this in. Don't put in your Medicare. I don't recommend that you do that. Then all these things down here, I'm interested. You may not be interested in this, all these different categories, but by having those checked, we can talk to you about Medicare supplements, hospital indemnity. We can't talk to you about certain things during Medicare season. We can't talk to you about long-term care. We can't talk to you about life insurance and other things. But very simply, gives us access to all these other things that we can have a conversation about. This is our government telling us what we can and cannot do. So with that, type in your name down here at the bottom twice, hit submit. We get an email that says John Smith just filled out this information. Now we can talk to you about all the different details in the plan summary. As you can see, the government site wants to log me out again, so we're just going to click that. It's gone. But let's go back to where we were, comparing drugs, this tab. So as you can see, like I just said, down here at the bottom, I can tell you the difference on this plan here. She's going to pay CVS $1,187. Mail order, saving around $80. Does that make a difference for you to do mail order? Remember, with mail order, though, it's going to be broken down quarterly. So if you're doing mail order, your cost could go up. The other thing is I wanted to see is that compared to her plan, not much of a difference because I'm comparing a Medicare Advantage plan. Actually, that's a heck of a difference, right? That was $1,800 with that plan versus $2,000. That's an $800 savings that she could actually have on her prescription drugs. Now, granted, we got to go back and take a look at these plan details. The plan details, this, as they say, the cost all comes into the details, right? So, Eliquis, CVS, this is where those costs are coming into play. I put in Novolog. Novolog, as you can see here, $105. And while I'm talking about that, let's just kind of hit on this real quick here. Sorry, I forgot to turn my phone off. So, with Novolog, it's an insulin. And you've heard all these things about $35 copays. It doesn't apply to everything. There's certain plans out there that are only covering it under a $30 copay. There's other things that will still have a factor, like the donut hole. Because if we take a look at Novolog here, we're looking at $1,780 for a 3-month supply because we typed this in for a 3-month. $1,780 is the true cost of that drug. And when you get to around $4,000, you hit what's referred to as the donut hole, the coverage gap. Then when you hit another, say $2,000, around $6,000, I'm not giving you accurate numbers because we can look those up, I can share them with you, but I'm shooting this video so that it's just basically next year it's close to the same. But when you're in that $2,000 gap, some insulins are covered through that gap, some are not. It depends on the plan. There's too many things, so don't always believe in what you hear. Let's go through and get the evidence to find out exactly what those costs are. But as you can recall that I put in those two drugs, I know she doesn't take them. So I'm going to go back as I scroll down into the plan details. I just went into, let me just go back and show you this. You could go into your plan details of your plan, go down, scroll all the way to the bottom. You're going to say, here it is. It shows you your quantities, your tiers, whether it's a brand, generic. I don't know if I mentioned this, but like on those commercials, Eliquis, you know, I like to use this analogy. These people are always happy, but they're not happy when they go to the pharmacy. This is where you can go in there and maybe take a look and see if you can save some money. I know she doesn't take Eliquis, so we're going to remove that. Success, gone. Also, Novolog, she doesn't take that. Success, gone. But these are just the things I wanted to show you that this can drive up your costs with a couple of medications. I know her drug list is up to date now, and I've already got the pharmacies chosen. So I click done. I'm already through this step. It's very simple to go back in and change medications, whether it's a quantity or monthly. Very simple. It's a well-designed site. I'm not going to take anything away from the government in regards to this. But if I look at the plan details now, plan details, here's her premium, here's the deductible. Now remember, I get a lot of people that ask this question, that deductible, $445. Remember, that only applies to tiers 3, 4, and 5. Did I get that right? No. Tiers 3, 4, and 5. Yeah, let's get that. 5. 3, 4, and 5. Okay, with that, if you have a tier 1 or a tier 2, you're not getting hit with this. There is another plan that's out this year that they are going to hit you with copays, and but typically the deductible, I'm talking about in tier 2s. But within a deductible, it's usually tiers 3, 4, and 5. But check your details. Now with that, look, the price drops dramatically as I'm comparing. $0. She goes to Kroger, everything is $0. So instead of that $2,000 bill, that was because we had the Novolog and the Eliquis in there. Go through. If you have a question and you have a problem with a certain medication, there's other alternatives. And I'm not telling you alternatives to the medications. I'm not a pharmacist. I'm not a doctor. And I don't recommend that you just willy-nilly change things. But let's go through and see what we can do to find some alternatives for cost. Maybe it's looking at Canadian pharmacies. I have a lot of clients that use the Canadian meds. I've got some good sources for that to be able to, you don't have to go through and figure out, is this the best option? There's different options. There's other things that we don't know about you sometimes. There's things like Medicaid status. There's certain people that actually have Medicaid that they don't pay nearly as much as what other ones do. And in regards to the Medicaid status, there's this thing by the government, it's called extra help, low income subsidy. So if your income is at a certain threshold and your medication cost is up here, there's a lot of times you can get some extra help to knock that down. And it helps you a lot throughout the year. So just remember that we have that as well. So with that, you know, this is how you go in, you create an account, you can go in, look at your different tiers, you can send us your drug list, we can compare that for you. It serves you better and it also serves us. Just imagine that you're out in California and you need a medication. You don't know the local. You could actually go into your myMedicare.gov account. Say you got your laptop or your phone with you. Go in and see what the price is at the local pharmacy. If you move or things like that, you can look up the plans in your certain area, what's available to you. You can compare Medicare Advantage plans. You can compare prescription drug plans. You can print your drug cards. You can look at your summary of benefits. It's all right here for you. And by you having this account, it also helps us because we get accurate information, accurate data to make sure that we can analyze everything. So with that, guys, hopefully you got enough information to go in, create your account, and then we'll communicate. Fill out that scope of appointment on the Medicareful.com/Dave Cook or Don Cook. Give Donna or myself a call. My cell phone number, area code 941-932-1388, or Donna's area code 941-932-1389. Look, we've got agents that work around the state of Florida. We're more than happy to be able to help you. Dawn and I ourselves personally are our agents, and we'll do what we can to make sure that you have the right plan for 2021, or if it's years beyond this. And I'm just showing you a good system to make sure that you understand you can actually do this, and it's very powerful for you to be able to have these tools available to you, and it helps you along with helping us. So with that, pay attention for more emails, more videos, and we'll talk to you next time. Thanks, guys. Appreciate it. Bye.